Well, you know, it can be a terrifying situation for everyone involved. Actress Carrie Fisher, it happened to her. She was on that flight from London to Los Angeles when she went into cardiac arrest. Her plane was 15 minutes away from landing when this happened. Now, there was a medic on board, a nurse on board, and also the staff that's trained to help in case of an emergency. So what would you do if that happened to you or someone sitting next to you? Joining me now, Dr. Ali Kashryan with Kashryan Urology to kind of delve into this. And, you know, I think what the general public may not know is that there's equipment on the plane, good or bad, but it's there to help out in an emergency situation. And then if there isn't a doctor on board, the staff is there, and they are all trained in CPR.
So there's equipment on board. There's a defibrillator, which is very important for everyone to know. The staff's trained in CPR, and they also have on-ground consultants that they actually call. And they discuss, all the communication goes with the captain, and they always assess for the need to ground the plane and see if that's available. A big thing that was very fortunate in the Carrie Fisher story, that this cardiac arrest happened about 15 minutes before landing.
Right.
If this happened across the Atlantic in the middle of the ocean, this would have been a different story.
Right. And it's so unfortunate, you know, that she did eventually pass. But it is interesting to note that there was a doctor, there was a nurse, and then there was the other staff. You said you've even been called to action, and you've had to kind of jerry-rig things to make it work.
I mean, last May, you know, I was in a situation like this, and the thing you have to be mindful of is you're in a plane full of people. It's a small space. It's not well-suited to move people onto the ground. The family of people are worried. The other thing to keep in mind is you have to know your medical history and share your medical history with your family so that if something does happen, everyone's aware. Take your medications while you're on vacation. Have them with you on your, don't put them in your check bags. Have them with you on board. Make sure you hydrate. You know, simple things. When you're on vacation, you may not be eating or drinking as you would. You may be drinking more alcohol. You may be eating differently than you would in your normal day-to-day life. You don't want to be dehydrated as you're entering a plane. You don't want to stay dehydrated on a plane. We drink a lot of caffeinated beverages. You may be drinking alcohol on the plane. Those things can add up.
And you also talked about recently, you know, that this is the time of year, Christmas, the New Year, when you're a little high stress, the colder temperatures can affect our bodies in different ways. So it's important. And you talked about an app where you can put all of your information and you don't even need your passcode.
If you look on your mobile phones, a lot of them have medical information apps, and also the phones you can put all your medical information even without getting into the password, where people can access it, where all your medical information, your medications are there, and people can access that in times of an emergency. Use those things to better benefit you so that other people can help you in situations like this. The other thing to keep in mind on a plane is if something like this happens and you are the person looking to help, you know, one thing you always kind of remember is resist the urge to help. That doesn't mean that you don't go and help.
Right.
Be mindful of the scope of your ability to help. You know, on a plane, again, the crew knows CPR. They know how to assess help. Use the people around you to help in the best way that you can so that you don't hurt more than you help, and get the team to help the person the best that they can from that standpoint.
Right.
And make sure you're healthy, make sure the people around you are healthy from this standpoint, so that if something is going to happen, everyone works together to get the person to safety.
And you even said there are a few things that you can do. If you know you have an issue, get up and walk around on a long flight.
That's a very important thing. If you're on a long flight, one of the big things that happen that you hear about and you read about in terms of people getting up and walking around is a deep vein thrombosis. So if you're sitting around not moving, blood can't circulate as well, and so a deep vein thrombosis is a big risk factor, and that can cause a blood clot. If it gets into your lungs, you have an immediate respiratory arrest, meaning that you have breathing issues. So getting up and moving around, letting things move around, and about 12% of issues on a plane are respiratory.
Right.
So that's one thing that really be mindful of doing from that standpoint.
You never think when you're going to get on a plane that something can happen or
be very mindful.
But
know
it's
your medical history
and
make sure that you enter the plane healthy, do things to stay healthy, and if you're going to help with a team and make sure that everyone is healthy on the way to the ground.
Gotcha. All right, thank you. For the latest on health headlines, go to newsforjax.com. You will also find this interview. If you'd like to watch it again, it'll be posted there later this morning. All right, so